Hello, everyone. I am Paul Sonata, your webinar host and manager of Benetas's Centre for Cultural Diversity in Ageing. Welcome to our webinar, Preventing and Reducing the Impacts of Gambling, how aged care providers can support older people from culturally and linguistically diverse backgrounds. Our speaker is Tanishkka Yadav. Tanishkka is a therapeutic counselling psychologist from Settlement Services International. She's an ACA Level 4 counsellor and also a provisional psychologist with more than 7 years' experience in mental health and is currently working at Settlement Services International as a gambling harm prevention therapeutic counsellor supporting diverse communities through compassionate, client-centred care.
Today's webinar focuses on gambling harm within culturally and linguistically diverse or CAL communities, particularly in the context of aging and older adults. As professionals working with older adults and diverse communities, many of you may have encountered clients experiencing stress, financial hardship, emotional difficulties, family conflict, or social isolation. Sometimes gambling-related harm may be an underlying issue that is not openly discussed. Our goal today is to build awareness, improve confidence in recognizing indicators of harm, and explore how culturally responsive ways, how can we support individuals and families. By the end of today's session, participants will be able to identify indicators of gambling related harm, understand gambling harm through a biopsychosocial lens, recognize barriers impacting CAL communities, and initiate supportive conversations and referrals around gambling. Today's session is designed to be practical and reflective, so no jargons in the session. Rather than focusing only on gambling behavior itself, we will explore the broader emotional, social, cultural, and psychological impacts gambling can have on individuals, families, and communities. We will also discuss how gambling harm may present differently in CAL communities and among older adults. Before we begin, I would just like to take a moment to talk about our organization, SSI. Settlement Service International is a national not-for-profit organization supporting individuals, families, and communities across Australia. SSI works across more than 52 programs and services throughout Australia. Our work focuses on helping people overcome barriers, access opportunities, and improve well-being. The Multicultural Gambling Harm Prevention Program specifically aims to provide culturally safe and accessible support for individuals and families impacted by gambling related harm. When we talk about gambling harm, it is important to understand that gambling related harm extends far beyond financial loss. From a public health perspective, if we look at it, gambling harm can affect mental health, relationships, physical well being, housing stability, and community functioning. So, there are a lot of areas throughout which gambling harm can adversely affect it can be adversely affected by gambling harm. There is no one area, but rather it encompasses many areas where gambling harm can be visible. As psychologists and support professionals, we often see the emotional consequences first. But when we talk about looking at it from perspective of anyone dealing with CAL communities or older adults, I think it would be a good idea when a client to have a look at these symptoms. When a client presents with depression, sleep difficulties, chronic stress, hopelessness, or relationship issues without initially disclosing gambling concerns, it is a good idea to have that in the background in your head as well. because there's a lot of shame, there's a lot of stigma in these Cal communities when it comes to gambling. And that is why a holistic, person centered, and trauma informed approach is so important. Cal communities may experience unique vulnerabilities that increases the risk of gambling related harm or create barriers to seeking support. Some of these are there on the screen. I will not read them out again because there's a lot that I want to discuss in the session today. So, for many individuals, gambling may initially serve as a coping strategy for loneliness, for stress, grief, or social connection. In some communities, gambling, even though not viewed in a very positive light, can serve these gambling venues may serve as accessible social environments where individuals feel a sense of belonging. However, stigma surrounding mental health and gambling can make disclosures very, very difficult. People may fear judgment, loss of reputation, or bringing shame not only to the one person who is gambling, but to the entire family. This is why culturally responsive engagement is essential. We need to approach conversations with curiosity, empathy, cultural humility rather than any assumptions or judgment. And I am also someone from Cal community, and let me tell you, a lot of the countries that people come from, gambling is not legal. So these all these big casinos out there, it can serve as a means of amusement. They might want to go once, look at what's happening around there, be fascinated by it. But there's a very thin line of difference between gambling responsibly and gambling becoming an addiction and taking over. So we need to approach it from the understanding of and perspective of they have not grown up seeing gambling. They might not have grown up seeing gambling in their community and country. It might be a very new thing for them because gambling is not legal in a lot of countries. Talking specifically about older adults may face several life transitions that can increase vulnerability to gambling related harm. Probably their spouse passed away, they have some chronic illness, they have financial insecurity, they are lonely. But they, obviously, along with these risk factors, there are some protective factors as well. For example, they may have community support, family support. As clinicians and support workers, we should consider how gambling may sometimes be linked to unmet emotional or social needs. For example, an older adult who recently lost a partner may begin attending gambling venues more frequently as a way of coping with grief and loneliness. And I have personally seen it happen. A lot of gambling venues see an increase of attendance of older people when their spouse passes away because they're trying to distract themselves. They're trying to temporarily not think about their spouse, have some people around them, be in a space where they forget whatever is happening in their lives. So, that is one behavior which we need to screen for in our everyday work. Some of the clinical indicators and presentations which people might present with if they are dealing with gambling related harm are listed on the screen. As professionals, it is important to remain curious about patterns and behavioral changes. And, and let me tell you some of the screening questions which we might ask in these sessions. We can ask the client, and we can rather see for ourselves if the client has become increasingly withdrawn. Are there any unexpected financial concerns? Is there heightened family tension? Are they experiencing shame or avoidance? And we can probably gently, in a very non judgmental and exploratory way, ask client, I've seen you frequent venues a lot of times. I wonder what's happening. I wonder if you have made some friends at the venue. What's happening over there? So basically, not pushing them for disclosure, but rather supporting them in the entire process. Now, let's look at something very, very interesting. These are scans of people when they started gambling and when they became a regular gambler. What it shows is Gambling becomes a reinforcing system. Our brain's reward system changes as we gamble. When someone gambles, dopamine is released, creating feelings of excitement, anticipation, or temporary relief. Dopamine is a neurotransmitter, by the way. Over time, individuals may begin gambling more frequently or spend larger amounts of money to achieve the same emotional effect, as we can see in the scans as well. The brain is vigorously lighting up when they are probably going to gamble the first time, or probably when they are gambling with a shorter money, for example $10. But to get the same level of excitement and thrill again, they need to either gamble for longer amount of time, or they need to gamble with more money. It's similar to alcohol in a way. To achieve the same high, as tolerance builds up, we need to consume more alcohol for the same high. So, similarly with gambling as well, this can make it increasingly difficult to reduce or stop gambling behavior. It is important to remember that gambling harm is not simply about lack of willpower. There are complex neurobiological, psychological, emotional, and social factors involved. But the good thing is, there is something called neuroplasticity of the brain, which means as we change our behavior, what's happening inside of brain changes as well. For that matter, there has been research which shows that when we change our behavior, our brain physically changes some of its structures as well to cater to the new normal. Now, let's look at some trauma informed and culturally responsive practice. Many individuals impacted by gambling harm may already feel significant shame, fear, or hopelessness. Some may also have histories of trauma, migration stress, discrimination, or family violence. Cultural humility, that's why, becomes particularly important. Rather than assuming we fully understand someone's cultural experience, we should remain open, reflective, and willing to learn from client's perspective. A very good idea would be to ask questions like, "Oh, thank you for telling me about it. That's a rather interesting practice in your culture. Would you be willing to tell me more about it? I'm willing to learn through you. Can you tell me a little more about how is gambling perceived in your culture?" Or in general, also, just to be culturally responsive, ask a lot of open ended questions. Admit that they are the gurus, they are the experts of their own culture. Be humble about it, admit it, and then go forward. Because client senses if we bring in a tone of superiority and we come from the expert perspective of, we know everything. No, they are the masters and experts of their own situation and culture. So believe them, talk to them about it. Early intervention can significantly reduce harm and improve outcomes. Some helpful early intervention strategies can include routine psychosocial screening, gentle exploratory questioning, some motivational interviewing techniques as well. When discussing gambling, language matters. Instead of asking direct or confrontational questions, we might say, "Sometimes people use gambling as a way to cope with stress or loneliness. Has this ever been part of your experience?" Or something like, "I'm wondering whether gambling has had an impact on your well being, finances, or relationships." Again, as we talked about before, our focus is not on forcing disclosures, but on creating opportunities for safe conversation. When working with CALD clients, culturally responsive communication is essential. In many cultures, gambling related harm may be viewed as a personal or a family failure rather than a health issue. Client may worry about confidentiality, their community, or fear judgments from their own family members. Using respectful and strength based language can help reduce stigma. It is also important to consider family and community dynamics when planning any support or interventions around it. A lot of times, CALD clients will come to you and say, "Please, whatever you do, there is no way my family can know about it. There is no way my community can know about it." So we have to work around those issues and take those issues into consideration. Having said that, SSI, the purpose of SSI's Multicultural Gambling Harm Prevention Program is to raise awareness about the impacts of gambling harm and provide counseling and support for individuals, families, and communities. Our services include therapeutic counseling, workshop and community education sessions, and community grants because we understand a lot of times some communities may want to listen from people of their own community leaders. So we provide grants for the same. People can visit our website and apply for the grants. And Sophie, if you can share the link of our website in the chat as well, that would be helpful. So the sessions which we have with people, these are all free sessions. You don't need a visa. You just need to be impacted by gambling harm. And when I say gambling harm, it does not necessarily mean that you would have gambled to take our services. You can be a stakeholder to gambling harm and be affected by it if, let's say, you worked in a gambling venue, your family or one of your friend or relative or anyone you know has engaged in gambling and you have been impacted by it. So we're more than happy to cater to anyone impacted by gambling harm. These are all free sessions. We don't really care about the visa status. You just need to be present in Australia. SSI's Multicultural Gambling Harm Prevention Program also does not have a catchment area as long as you live in Victoria. We are the more than happy to have you as one of our clients. Sessions are delivered flexibly. We have our offices in various locations, but our head office is in Carlton. The person can either see us in person in Carlton. The sessions can be done over a phone call or online over a video call as well. So it depends how comfortable they are, what would they want to do, what makes them easier for them to access our services. Also, it is completely all right if the client does not speak English because we are capable of booking interpreters for each and every session that they might have with us. Interpreting services are available. And there is no cap, absolutely no cap on the number of sessions that they can have with the services until and unless they feel, or if the counselor along with them feels that the sessions are not required anymore, they can continue to have every sessions. I personally see a client whom I have been seeing for every week for almost the past year because I feel that is required. So these are some of the strength which our program has. How to contact us? This is our number. You can either directly call our number, you can visit our website, or you can email us on our email ID of Multicultural Gambling Harm Prevention Program as well. If you want, you're more than happy. We are more than happy to cater to you in our office as well. This is our address of the Carlton office. Please, I'm more than happy for you to contact us any way that is easy for you. Thank you so much for your time, for your participation, and for your commitment to supporting culturally diverse communities. Gambling related harm can often remain hidden, particularly among older adults and CAL communities. However, through culturally responsive, trauma informed, and compassionate practice, we can play an important role in reducing stigma, supporting early intervention, and improving well being.
I noticed that you spoke about the fact that anyone can use this service who has some sort of contact in relation to gambling. So it could even include people who are working in gambling venues and have some concerns. But it also may be people who are impacted by other people's gambling. So I'm often interested, for example, in the older person where there's a family member whose gambling is impacting them. It might be a child or a relative, for example, whose own problem gambling is starting to result in the older person having to pay for some of their bills or borrowing money from them. Can you tell me much about situations where you may have worked in where older people being impacted in that way, and how you might support an older person in that regard?
That's a fantastic question, Paul. And I would say a lot of older individuals become very vulnerable to gambling harm, even though they are not directly engaging in any gambling behavior, just because probably someone has access to their finances, someone controls where and how they spend their money. And I've had a particular case where the grandchild was stealing money from the grandfather's account because he had access to those accounts, and he did not know what to do. He did not want to m- make this a big family issue, because they came from such a background that if other people came to know about it, it would bring shame to the family as well. So we had sessions with him. We discussed ways of communicating that and educating his grandson around gambling, because we probably understood that he's too young and he's not aware about, first of all, gambling, and secondly, stealing money from grandfather. So grandfather absolutely could not understand what to do. He did not have that uh, emotional and I would say he just did not want to get in that discussion with his grandson. So we asked him if it would be okay for his grandson to come and have a session with us. We did not tell the grandson that we already know what's happening, but we just told him that uh, you have been given this platform, and you can take this opportunity to discuss whatever might be of concern. And we found out that the grandson was already exhausted because of, and rather in a lot of mental agony and pain with what he did. So he talked about it, we gave him some psychoeducation, and we continued to have further sessions with him. So that is one of the example how an older adult might be impacted because of gambling related harm. And a lot of times it has also been seen that a partner gambles because they've grown older, they want to engage in a lot of free time that they have around. So a partner goes and gambles, might meet a few mates over there, and the other partner feels lonely because of the same, because the partner is never around. They're always at the venue. So some ways of dealing with the same and exploring and unpacking that in the sessions has also been seen.
That was great because, in fact, you're able to use the grandfather to draw the grandson actually into, an effective, therapeutic response. Like that's fantastic. Like in one step, you actually were able to then assist the grandson. But in other situations, I suppose, where the child or relative didn't want to sort of be drawn into addressing their gambling issue, I suppose that's potentially able to be framed as a situation of elder abuse. And maybe in other situations, like if there's a spouse who or partner who's gambling away, um, their income, potentially it's also a situation that could be framed even in a family violence context, particularly if, one partner was very insistent on, their gambling, and that was leading also to controlling behaviours and violence. Like there's some other interesting lenses that could be overlaid on these situations. Have you ever had to involve elder abuse services in with older adults? Or is that something that you potentially see could happen?
You're very right when you say this. And we have specifically seen regarding major holidays around sports, and whenever there is a, in general, also whenever there is Christmas or any other holidays where we can see that probable engagement, a celebratory engagement in gambling might happen, we have more calls regarding domestic violence. We do not directly cater to domestic violence, but we probably direct them to 1800 Respect or Orange Door. But yes, I've had instance in the past where I had to refer one of my client to Orange Door regarding the same.
Now we have a comment here from Peter, and this is a broad-based comment. Peter says to us that many governments increasingly frame gambling harm as an issue of individual responsibility, yet modern gambling systems are built on sophisticated behavioral science, neuroscience that you've presented to us today as well, predictive analytics, and algorithmic engagement models specifically designed to maximize user retention and spending. At what point do we stop treating this purely as a consumer choice issue and begin recognizing it as a structural public health and social cohesion issue, particularly when the harms disproportionately impact vulnerable, migrant, and economically stressed communities? So, do you ever sort of take that broader structural social lens, Tanishkka, and how does that work maybe even in an education, community education context when you go out and speak with groups?
Well, I would say the more you tell someone not to do a particular behavior, the higher the chances that they will do it. A lot of countries where gambling is not legal, it is done underground. It still happens. No matter what you do, it will still happen. All we can do is create awareness around the same. Smoking kills, we know. Alcohol is not good for your health, but still, it is there all around. If I would say this is a problem, that is another, those are also problems that we have. What we have done is create more awareness around the same. Because I would say if government makes gambling illegal, it will still happen underground and government will probably lose a lot on taxes. So I don't think that's a good approach, but rather a better approach would be, for example, if you look at Crown is legally mandated to have a Crown Play Safe center where they can ban themselves. They can ban themselves not only from the casino but from the whole area of Crown. There are counselors over there. So when it is there out in the open, at least there can be something done about it. When it is not even legal, God knows what will happen. Look at a spring, I would say. The more you push it inside, when you leave it open, the more it will bounce. So, if I tell you right now, the little exercise which probably you can do in your own time, if I tell you to close your eyes and think about anything, but just not imagine a pink elephant riding a bicycle. And let me bet on that, all you will be able to think about is a pink elephant riding on a bicycle. So I would say, yes, it is a very, very big issue. It needs to be dealt with all seriousness that there is. There needs to be more education, a more awareness around the same, and just people should know what they're getting themselves into. Probably because of all the propaganda, not propaganda, but all the advertisements and education that has happened around smoking. We know that it causes cancer. We know that there would be negative impacts of it. Similarly, with gambling as well, we need similar talking around it.
I think you spoke a little bit about earlier on about protective issues, and I was interested, to think about that. You said that that oftentimes there can be some protective factors, and you created. I suppose you painted an interesting scenario of when for an older person you might see a gravitation towards gambling, and it may be in that post bereavement loss, particularly of a partner, a life partner, a spouse. And what sort of strategies do you think may assist people to, I suppose, not be so reliant on engaging in gambling as a form of entertainment or social contact? What's the sorts of things that you might, working with an older client, give them as some tools to help them be less reliant on gambling to fulfill those needs?
When one's partner passes away, they are grieving. They need as much support as possible. So probably human connections is one of the thing. One of the most important thing would be talk to their grandchildren, if any. If not, people around in the community, join some community group. A lot of community groups meet each other, and there are these older people groups. Probably join one of those. Other than that, I would say pick up a new hobby. Pick up something new to do in your time, golf or anything. Just giving an example, because I see a lot of people, older people, playing golf and happy, and come across it. In fact, that is one of the strategy which was suggested by one of my client, that now instead of gambling, they go and they play a sport. They still have they still have association of community members over there. They can chat, they can probably go around. Nature is there as well. So, as much connection as possible after a spouse passes away, because it is incredibly painful when a spouse passes away. Most feel lost. Having lived with that person for so many years, one feels lost. Finding that social support and engagement outside of gambling venue would be one of the best strategies that one can engage in.
Lindsay has said some hotels and clubs offer outings, as Lindsay has put inverted commas around it, to seniors groups by busing them to the venue where pokies are available. This can be attractive to people with limited mobility and social isolation. Um, is it important for these groups to have assistance in providing alternative recreational and social activities? So, there is I think he's outlining a scenario sometimes where older persons groups themselves see, oh, well, that's an easy one. Or maybe they even get a free lunch with that. Um, I suppose, is there some community education that perhaps needs to be done with the organisations that are running those groups to think a little bit more about, how they might do that, but do that in a way that's fairly managed? What would your suggestions be if you were going out and talking to a community group that says, "Oh yeah, but we love going to the pokies as part of our monthly activity or outing"? What would you suggest to those groups?
Well, I would suggest it would be a good idea to find a new monthly activity or outing to do rather than going to cookies. And let me tell you one thing, with older adults, I've seen there is this myth, and not only with older adults, with a lot of people out there, there is a myth. And I've seen older adults take a train, probably from another city, come to Melbourne's Crown Casino, start in the morning and leave at night, and they just sit over there for hours and hours. There is a free lunch provided, as you just talked about, and they relish that. And there's a whole group which comes in, and there is this idea that the longer you sit, the more money you'll earn. But let me tell you, that's a myth. The longer the sit, in fact, the more are the probability and chances in favor of the venue that you will lose. Consider it this way: if we flip a coin, there are 50-50 chances of you either winning or losing. But with a lot of machines that are there in the gambling venue, they add in zero. And just imagine if there are 36 numbers but a zero, the probability of you losing becomes even more, and the probability of the casino winning become your chances are no longer 50-50. It's probably one third of what it originally was. So if you have a win in the casino, just leave at that time and go. And winning, people often talk about lady luck in casinos. People say, "Oh, I have lady luck, that's why I won," or "I need lady luck." But let me tell you, lady luck over here is nothing but Madam Chance. And Madam Chance is very fickle. If she's there with you this time, she might not come again for another years or hours or whatever.
Frank Sinatra had a famous song that he sung, "Luck Be It Lady Tonight." So that's quite interesting. So maybe, just maybe, one of the potential things working with older people's groups. And I've run myself. I've run a planned activity group program back in the days of home and community care funding, and it was very important that participants actually co-designed the schedule of activities. We used to run to a 6-week cycle, and we'd do a planning day, a planning morning every few weeks to plan the activities. So it wasn't just the staff planning the activities. So the modern day version of the PAG groups is the social support groups, but we actually got them to design the program. And sometimes they would want to. This was in a rural area, and there was a venue, and it was a very nice venue, by the way. And so they said, "Oh, can we do that?" Maybe, do you think there's room that you could, if you say, "Look, we're going to," you all agree that you want to go to the venue and you want to spend a day. Maybe there's a little bit of education that could go with that, just along the lines of what you've said. That maybe some education about, well, do you know what the chances are? Maybe some education about putting time limits on engaging gambling, so that when everyone goes, maybe along to that group in a sort of a harm minimization approach, people go in with all eyes open. There's a bit of myth busting done about, the likelihood of winning, etc., so that you're going there as an educated gambler or as an educated participant in the activity rather than going there, having these maybe a set of poorly founded beliefs that we might call superstitions, which really, drag people into spending money, maybe even educating people about, having a limit. What limit are you going to put in place before we go out today? What's your limit for how much you will spend? Would that be the sort of thing that you could do in as a recreation group?
I think that's a wonderful idea, Paul, because if everyone agrees that they want to go gambling, there is hardly anything that one would be able to do to stop them. But what we can do is minimize the harm. There are some strategies which I'll just tell you right now, which can be used when probably taking a group or educating someone before they go to a gambling venue. First of all, tell them decide on the amount of cash, not through card or anything, but hard cash that you want to spend, and take only that money in the gambling venue. No cards, no other ways of paying, but just that hard cash. Decide on it and take only that in the gambling venue. Second would be decide on the time limit. Decide on the time that you will spend in the gambling menu, no matter if you're losing. If you think that, oh my God, if I keep pushing the pokies a little bit more, there's going to be a jackpot. If you decide on 1 hour, 1 hour it is. So, first of all, limits on the time and money that you spend. And third would be accountability. Tell someone that you are probably check on me after this much time. I'm playing at the gambling venue. Just give me a call and talk to me. Fourth would be taking a break, and probably talking to someone can also be a form of taking the break, because there has been research which shows that once you get up while you are playing a game, there are lesser the chances of you going back, because it breaks that routine, it breaks the continuity of you playing. So, taking a break, decide if you want to take a break after 15 minutes, 20 minutes. Your limbic system, which has overpowered you at that time, your emotions which have overpowered you, oh my God, I'm losing, etc., etc., it calms out a little if you take a walk. Your prefrontal cortex takes over and you start to think logically. So these can be some of the strategies. And then again, telling people about us. I think someone mentioned in the comments that Australia loses the most amount of money to gambling, and you're very, very right. It does. So a lot of our festivals, a lot of our holidays are around gambling as well. So yes, I think we require more and more education, awareness around these myths related to gambling. As I was talking about, the longer you stay, you don't win more. The longer you stay, you lose more. The longer you stay. Uh, Having information about classical conditioning and how, because if you routinely sit on the pokies, just listening to the rambling and the sounds of these poking machines also can attract you again. Understanding this, even casinos use a lot of psychology to attract people over there. If you'll ever look at a casino, it's you won't really see any edge. It's all round to give that feeling of infinity. You won't see whether it's light, it's morning or night outside. It's like a whole together different world which is out there. You sit on your seat and you'll have alcohol served to you, or you have food served to you where you are sitting. So they have built the whole system such a way that you sit there for longer. Being conscious of those facts, recognizing those facts, I think they can take a long way.
Thank you so much, Tanishka. This has been an amazing and an interesting discussion, and I love what you had to say there, just about how there is sometimes a tension between a group of people who want to do something and how you could take a bit of a psychoeducation and harm minimization approach ahead. Thank you today, everyone, and we'll see you next month at another webinar.